Namaskar, hello and welcome to Dr. Chhajlani's YouTube video channel. This presentation is on how to treat injuries and wounds in a gentle way. Whenever we see a wound, and especially when we see bleeding, we all get alarmed and rush to someone who can take care of it immediately. This video is to tell you not to rush anywhere and how to treat the problem yourself initially as a first aid before you take the person to see a specialist or a doctor. Here we'll talk about basic wound dressing, and here the wound can be cleaned with povidone iodine, and then it can be gently wiped after the bleeding has been controlled, and then we apply an antiseptic or an antibiotic ointment which acts as an interface or prevents the wound from sticking, the dressing from sticking onto the wound. We use a paraffin gauze dressing over the ointment, over which the cotton gauze is applied, and the ointment and the paraffin ensure that the dressing is comfortable for the patient, and it can also be removed painlessly once the purpose is served. After the bleeding is controlled, the dressings are applied, and then a paper tape or a micropore tape dressing is given. The central part can be left open to allow breathing. The dressings should be appropriate, just right, and should be adequate enough so that it serves the purpose and it stays till it is deliberately removed. After doing the dressing, ensure that there is no bleeding, or if it is there, then control it with pressure. So this is how a basic dressing is done, and all dressings are done in a similar way. Now, once we see a patient who has a bleeding wound or has a wound, then it's important to remove the person from the site of the injury and make the person lie down and make the person comfortable. And most important thing is to control the bleeding, and it can be controlled by pressure, and don't stop the pressure till the bleeding has stopped. And then dress it if it is available. If the dressing material is not available, then shift to a center. Before starting the dressing, make sure that the patient's pulse and breathing are okay. And once that is ensured, then we have to realize that all contaminated wounds need to be cleaned, and even clean drinking water can be used for cleaning the wound, and water does not harm. Most of the small cuts, bruises, and can be treated at home, at least initially, or at the site of the injury, and then the person can be shifted to a specialized center for appropriate treatment. When we see a patient with a burn, it is important to remove the person from the site and then use cold water compresses. So a napkin or a hanky dipped in water can be wrapped on the face or the hand or the burn part till the burning stops, sensation stops, which may take 15 to 20 minutes. And then it can be wrapped in a clean cloth, or it can be dressed and then shifted to a center. Now this are the contents of a first aid box, and it's important to have it handy. And it contains these things, but the most important is povidone iodine solution, an ointment, gauze, and bandages. And with these basic things, any dressing can be done. As we've explained at the beginning how dressing can be done. Now, when we do the dressing, it is important if you can use an ointment which is antiseptic, and also use a dressing which does not stick. It's important to know not to use strong chemicals because they can prevent wound from healing. Like in this patient, only when these substances were stopped, nothing else was done, and the wound healed. So these chemicals need to be used in high dilution or not to be used at all. When we have contaminated wounds, they need much more specialized care because these are wounds which have a lot of dust and grit, and multiple wounds which have been on the roadside, wounds which are bleeding, they all need specialized care once the first aid has been done. When a wound like this is there, the bleeding can be controlled, and a skin glue has been used by a doctor for immediate wound management, but they can also be stitched. When there are small bleeding wounds, they can be controlled with pressure, and antiseptic ointment can be applied. But when there are roadside accidents, when there's a lot of sand or grit, when there's contamination, when there are multiple wounds, then they need to be taken to a specialized center where the wound needs to be cleaned, and the wound may need to be repaired or stitched to get the ideal result. And this is important because if the dust and grit remains in the wound, then the healing is not good, and the scars which form are not good. When there's a gross swelling, when there's a possibility of a bony injury, or when the bleeding cannot be stopped, then these patients must be shifted immediately to bigger centers. When we see wounds which have been stitched, and if we can make out that the stitching has not been appropriate, then it needs to be redone. And even sometimes when the stitching looks to be good, then the history is important, because has it been stitched by the right person under local anesthesia or under anesthesia or not. If not, then they need to be re-explored, because sometimes foreign bodies can be found inside these wounds, and an appropriate care must be taken right at the beginning. For best results, the initial care is the most important, because if done properly, then we get long-term good results. If not done properly, then we get wounds like this which have sand or grit which has been covered with skin, and it will be very difficult to improve these wounds in the long run, and they also form bad scars. When we see somebody with a burn, as we discussed, it's most important to reduce the burning sensation, which can be done with the use of wet towels, which can be repeatedly made wet till the burning sensation stops. And then it is best to dress it only with a clean cloth, or use petroleum jelly, oil or honey, and then use a fresh cloth so that the cloth does not stick, and then take the person to a doctor for a specialized care. A lot of burns on the hand and on the face can be treated as open dressings, or the hand can be dressed in a glove so that the hand can also be used, and it is also dressing. And an ointment is always used, and burns also need specialized care. So after initial first aid management, these people need to be seen by a doctor to assess the degree of the burn. And electric and hot oil burns must be treated at specialized centers. Dressing is an important part, like icing is an important part of any dessert. Dressing need to be just appropriate, properly done, and should be such that they do not block important areas like the eyes, nose or the mouth, and they should be snugly fitting, and they should not come off by themselves till the purpose is served. Once the wound heals, a scar is sure to form. To ensure that there is a good scar, make sure that the first and the initial treatment has been appropriate and well done. But if the scars form and are not good, then they need a specialist to take care, and multiple modalities are needed, like injection, pressure garments, to make sure that they form good scars. It's important to make sure that we do not use strong chemicals. We must have a first aid dressing kit at home, and with this small training, we can ensure that we take care of our patients and give them the best results.
Thank you and welcome once again.